quite sure that it won't flip. This time you're going to get a hot feeling in the lower part of your tummy, dear. All right, just a little one this time. 1, 2, 3. Okay. How are you doing? All right? Okay, all right. This time it'll be lower down in your tummy, okay? There we go. All right, breathe in. Breathe out. Hold your breath. Hot shot coming.
Abdominal Arteriography with Dr. Robin Watson, Chairman of the Department of Diagnostic Radiology at Memorial Sloan Kettering Cancer Center and Associate Professor of Radiology at Cornell University Medical Center in New York.
For the patient, abdominal arteriography should not be a particularly unpleasant procedure. And for you, the physician, it can be extremely useful in leading you to a diagnosis in a great number of conditions. What are the indications for this procedure? The vast majority of patients are examined for vascular problems related to arteriosclerosis. I think it should only be performed when necessary. I know that sounds obvious, but when you're talking about vascular diseases, the physician may say, let's do an arteriogram and see what it looks like. I say no. I ask them if they're going to operate, and they say that they're not sure. I say, when you made up your mind whether you're going to operate or not, then I'll do the arteriogram. You want to order an arteriogram when the information you get will determine your treatment. In the area of abdominal arteriography, you may want to order the procedure to locate a bleeding problem, such as bleeding esophageal varices or a bleeding duodenal ulcer, or to determine the precise location of a mass lesion that you found by means of other studies, such as a standard upper GI series, or to determine the operability of a lesion. You may have a patient with a lesion of the liver. If it's a solitary lesion, then you can probably resect it. Or to differentiate benign cysts from malignant lesions of the kidney, because the arteriographic outlines will be quite different. With this in mind, let me show you how we used abdominal arteriography in this patient. An elderly lady whose doctor felt he detected a mass in the general region of the head of the pancreas. She had vague upper abdominal symptoms which might be related to this mass, but it might have been due to nervousness. She had the usual upper GI series, a flat plate, and a barium swallow. Maybe there was a suggestion of a retrogastric mass, but nothing definite. We needed to know if she had a lesion and where it was, in the pancreas or in the retroperitoneal space. Now, this patient had another problem. She was one of those fairly rare people who are allergic to contrast medium. She had previously had an IVP and her eyes had swelled shut. I don't pay much attention to minor local reactions, itching or